Well, it's great to be here today with my new friends, and I see also Dr. Mark Laufer, childhood friend, colleague, and actually an advisor to this presentation and the work, along with his father, who's an environmental scientist, and so very proud of that connection. So it was a small world. The longer you're in the field of medicine, there's so many great connections. So I'm here to speak to you today about breast cancer and then its causes, and maybe start really thinking more rigorously about the overlap between breast cancer risk and the risks of endometriosis, and to always look for shared insights to improve both areas. So when people look at this pink ribbon, you think, oh my goodness, breast cancer, pink ribbon, breast cancer, I got this. And in fact, awareness is so high, but knowledge is still very dangerously low. And I actually think that awareness interferes with knowledge because you so quickly think, I got it, when you see the pink ribbon, but in fact, what you really need to know is largely missed. You might not know that breast cancer was relatively rare 100 years ago. Even a half century ago, it was much less common than it is today. And it has since become the most common cancer to affect women. Truly, the breast is the favorite place for cancer to occur in a woman's body. And what you see is 30% of all cancers in women start in the breast. Contrast that to the next most common lung, then uterine cancer, 7%. Ovarian is about 3%, but there's something very unusual going on in the breast to make it so disproportionately affected by cancer. And the reality also is that the incidence of breast cancer continues to rise in large developing nations and including developing populations within our own country. And it's not because of inherited genes. You probably know that only about 10% of breast cancers are due to one of those single rare genes like BRCA1 or 2 that increases your risk by up to about 85%, like what Angelina Jolie had. Yes, that there are some small to medium-sized genes that may be inherited, but their risk level is more like 30 to 40%. So it's not the dominant reason why breast cancer occurs, and the breast cancer genes are not the reason why breast cancer has become so common. These are inherited ancient abnormalities which are really unchanged over centuries, which means about 90% of breast cancers are largely due to other factors, epigenetic, environmental, lifestyle, factors like that, and we'll explore that today. So whenever you're looking at the most common cancer to affect women, you need to minimize this maximum risk. We call it mini-max in medicine. We can't do everything, but at the very least, for each patient and at a public health level, we need to minimize the maximum risk, which is the mini-max principle. And we believe that prevention is the best form of cure. And prevention has such an impact, so it's trying to reduce the risk of getting breast cancer to begin with. If you've had breast cancer once, you're at higher risk for not just having recurrence, but having another secondary cancer, unrelated and independent event. If you have metastatic breast cancer, you'd love to put the cancer in remission. That's a form of prevention. And then, of course, prevention has an impact on the next generation. Many people in the room remember the DES story. Giving DES to women to lower the risk of miscarriage led to a higher risk of breast cancer later in their unborn daughters when they hit their 40s. And we already know that what you do as a parent, as a mother during pregnancy, can influence breast cancer risk. Untreated diabetes during pregnancy is associated with a high risk of breast cancer in your unborn daughter later on. And also, of course, prevention affects our loved ones, because if you can prevent a case of breast cancer, you spare your loved ones from going through the devastation of breast cancer. And now, finally, we have scientific evidence that prevention works. There's the Harvard data, the nursing data, that shows that if you were to intervene with a healthy lifestyle as a girl, you could lower the lifetime risk of breast cancer by 70%. And the Colditz data, which I know went out to all OBGYNs, showed that even if you started age 50 and took 5 steps, like getting to a healthy weight, exercising regularly, limiting alcohol, avoiding pharmaceutical hormones, and eating well, you could lower the remaining lifetime risk by 50%. So let's talk about why. Why is the breast the favorite place for cancer to occur in a woman's body, and how we can use those insights for prevention. So what you got to know is that the breast gland itself is very unique from a biological point of view, different from every other organ, including the endometrium, which is unique in its own way. So just think about the breast. It's organogenesis. Yes, it's the nipple and the breast bud is sort of made during the first trimester of pregnancy. But then the project is sort of over for a while. Meanwhile, all of your other organs are fully made and get to work. The baby's, second trimester, the heart's beating, you can track it. Baby's drinking and peeing, you can see the kidneys doing their job. The baby starts kicking, bones, nerves, and muscles are working. Baby is born, the lungs now work. But the breasts are not working. And one reason why all those other organs are more resistant to cancer is because they are developed fully over a short period of time. They are matured enough to do their job within a relatively short period of time. They are working 24/7, staying out of trouble for most of the time, whereas the breast gland development stays on hold for a chunk of time until puberty. We're going through puberty earlier, right? And then between 8 to 18, the breast gland is largely made. That's a long period of organogenesis. And even between 18 and 25, the breast gland is still growing. The mound is maturing, getting wider. And the fact is that when you're making a breast gland, it's like copying a key. You've got a set of DNA, you're copying that, and you're copying a set of key, they copy the copy, copy the copy, et cetera. And you know that the copy that you finally make may not open the front door, it may not function well. Every time you are in the middle of organogenesis, the DNA is very sensitive to any disturbance or any insult that may persist, is not repaired, and may lead to a higher risk of problems down the road. And it's also true that what our girls eat, drink, breathe in, medicines they take, personal products they use, are actually the ingredients that the breast tissue is made of. And the fact is that you've laid down the foundation of your future breast health during organogenesis, during adolescence. But what's also really unique about the breast is that even when the breast gland is fully made, it is an immature organ at the cellular level from a molecular point of view. It is incapable of doing its job of making milk until it goes through that first full-term pregnancy. And that is the first time at the molecular level that these cells are matured, they've grown up, and it's not until breastfeeding itself that the final maturation occurs. So when you think about the uniqueness of the breast gland, such a long period of organogenesis, and even when the breast gland is made, you've got this immature organ that is highly sensitive to anything that looks like, smells like, tastes like like a hormone. And it's not until, as I said, first full-term pregnancy, breastfeeding, when that gland finally grows up, gets a job, gets to work day and night, stays out of trouble, and becomes much more resistant to cancerogenesis. And so look at the trends that you're seeing in your clinic. Today, the average age of puberty is 9 or 10 compared to 100 years ago, more like 16. So early puberty is a risk factor for breast cancer as it is for endometriosis. And the earlier you have the breast, the sooner they're available to interact with the environment. And then today, instead of having your first full-term pregnancy around 19 or 20, like my mother, we're getting educated, we're getting jobs, we're developing ourselves, we're making our careers, and we might not take our first crack at it until we're in our 30s. So now we've got organogenesis, starting at 8 or 9, you fully grown maybe 25, then you've got another 5, 10 years, maybe longer, for these breast tissue to be hanging out. And if you talk to the environmental medicine people, they will tell you that the breast is a sponge for what is out in the environment, and the breast gland is very promiscuous. It will fool around with really anything that looks like, smells like, tastes like a hormone. So that's the breast gland, how unique it is. and why it's biologically so much more vulnerable than any other organ that's made much faster, gets to work much faster. So now, let's look on the other side. Given the vulnerability of the breast, why is modern life so dangerous? And this idea of think pink, live green, which is that we've got the inside environment of the breast, this pink teardrop, with a yin-yang relationship with the outside environment. And your inside of your body is an environment, as is the outside environment. And they're constantly, there's a flow back and forth. Everything you eat, drink, breathe in, whatever you put on your skin, we deliver medicines to the skin. Those things can alter the marinade in which your breast cells live. So what's going on out there? Well, this shows the dramatic increase in chemicals in the environment that are hormonally active that never used to be there 100 years ago. So it used to be chemicals were made before World War II, mostly in laboratory, in manufacturing, stayed there. But now all of a sudden we've got rubber manufacturing, you've got nylons, repurposing of petroleum products, plastics, pesticides. All of these chemicals have been exponentially produced, and they're ubiquitous. They're way outside the manufacturing and plants and farms and places like they're being used everywhere. And just as a few examples that are relevant, so atrazine actually has aromatase properties and is thought to be hormonally active in that way. And atrazine is the most commonly used pesticide to grow corn and soy. And we also have plastics in our everyday. You all know about BPA, bisphenol A, which is a weak estrogen. It is present in the heavy plastic water bottles, number 7, that go upside down on a water cooler. They are also the plastic that's used to seal ink onto cashier receipts. And they are also used in the lining of food cans to keep the metal taste of the can away from the food in the resin that they use to line the food cans. In fact, when Consumers Union did an analysis of food coming out of cans, it was Progressive turkey soup or vegetable soup that had the highest BPA level. And while we've taken BPA, bisphenol A, out of baby bottles, we still have it in many other products in the environment and is hormonally active. And not only that, but it's thought to be an obesogen. So it's one of those things. And the scientists in the pediatric division are looking at BPA as a hormonally active substance that can help trigger the early onset of puberty and bypass the whole normal axis that we believe is what stimulates the start. Hormones given to people. So you know that 100 years ago we weren't doing that, right? And the story of the use of hormone replacement therapy, progestin with an estrogen after menopause is associated with an elevated risk of breast cancer, about 20-25% increased risk, right, over time with extended use that goes away pretty much can go away when you stop it. But it's also true that birth control pills are used ubiquitously for so many reasons other than just contraception, and the risk of breast cancer it introduces is very low, a very small increased risk, but because breast cancer increases with age, if you, as young women, when you look at all the young women taking birth control pills, so their risk of breast cancer risk goes up with age. So if you're young, your risk is really low, and you expose a large population to something that increases it just a little bit, you're not going to really measure that big a bump. But when people continue to take birth control pills extended time, and into their 30s, 40s, when now the risk of breast cancer starts to increase substantially, then you're taking a population with a more measurable risk, increasing that a little bit. Now we're beginning to measure it. So we are seeing, on the list of breast cancer risk factors, extended use of birth control pills contributing to that. We know for the younger women, of course, their risk again is low. The risk of birth control pills on breast cancer risk is small, and they do get a benefit of reducing ovarian cancer risk when they're taking birth control pills for 5 years as young women, and that risk isn't, that benefit, that protection isn't really increased substantially after 5 years. So we'll look at that in a minute in terms of steps people can take. It's also true that hormones are given to beef and dairy cattle in order to increase milk. Not in all states. California has a rule against it. But this hormone does get into the milk. It is hormonally active. But there's another dairy practice which we don't talk about as much, which is that in order to keep the cows making as much milk as possible, they keep the cows pregnant, repeatedly impregnate. You keep them pregnant because that's when a mother, a cow makes the most milk is right after she's had a colt. So the issue there is that the dairy industry, the conventional dairy industry, will collect milk from a cow during her pregnancy when endogenous hormonal levels are high. What's in a cow comes out of the cow, and it comes out in the cow's milk. Whereas in the organic dairy industry, just so you know, a pregnant cow is penned after the second half of pregnancy when her hormone levels are the highest. So you're not going to get as much endogenous estrogen in the milk that comes out of those organic dairy farms. It's also good to know that estrogen is lipophilic. So the estrogen that's in dairy products does tend to be in the fat of the dairy product or the fat of the beef cattle. So that just gives you an insight into the things you can do. We'll go in a minute what you can do to lower your risk. It's also true that what comes around goes around. And I don't know if you remember about the concept of bioaccumulation, which is that as you go up the food chain, these substances concentrate. So when the teeny plankton is eaten by the tiny fish, then the small fish, then the medium fish, and the big fish. And as you go up the food chain, chemicals that we're concerned about concentrate. So who's at the top of the food chain? We are, right? But who's, in fact, at the very, very, very top of the food chain? It's the baby in utero and the breastfeeding baby that's feeding off of us. And so it's good to be mindful of the food chain when you are selecting your foods, to select the healthiest foods with avoiding that bioaccumulation phenomenon. So given all these dangers of modern life and the vulnerability of the breast, we really do need to think pink, live green. And what's good news is that our bodies do have amazing capacity to forgive and repair, and for some of these risks to actually dissipate. Some of them, though, were introduced, at a indelible time, like in utero or during puberty, that we can't erase. But there's some risks that actually go away. So here are 16 steps that have the greatest impact at lowering your risk of breast cancer through taking steps called, in the idea of Think Pink, Live Green. And just so you know, at breastcancer.org, my organization, we also have breasthealth.org, which is about prevention. And there's a huge section on Think Pink, Live Green. We have a booklet that you can download on this, and there's a lot of rich content written for consumers, but a lot of our HCPs consume it as well. But let's look at these 16 steps, and it's all guided, of course, by the precautionary principle, which means better be safe than sorry. We know a lot, so we're making these recommendations on what we responsibly understand, but we're not going to promise that you do this, it's absolutely going to have a benefit, right? But these are steps that we can do. And in medicine, we're always advising our patients about what can you do that makes sense, even if the data are not fully present. So just so you know, weight. Weight is a huge risk factor for breast cancer. So about 30% of breast cancer are thought to be due to increased weight. And right now you know that 3/4 of the American women population are size 14 or greater, which is almost the same as saying 2/3 of women are overweight or obese. That extra weight produces a whole mix of potent extra hormones, estrogen, insulin growth factors, as well as these cascade of inflammation, which is implicated in every illness as well as condition. Probably endometriosis, there are probably inflammatory factors that we share between both. And so getting to and sticking to a healthy weight is really important. Extra weight also is correlated with recurrence of breast cancer. So this is pretty much, if you were to say to a patient, what is the one thing that you can do to most effectively lower your risk of breast cancer, it is going to be to get to and stick to a healthy weight. Exercise. 3 to 4 hours a week, 5 to 7 is better. the reality is when it comes to weight management, 80% is what you eat, 20% is exercise. That's true, because it would take 4 hours to burn off a cheesecake that you eat. So 80% of weight management is what you eat, 20% is exercise. But when you actually evaluate what helps people be most effective at managing their weight, it's exercise. So of course these two go together, mixing it up, making it social, no excuses. It is true that after a diagnosis of breast cancer or after a life-altering condition, we as doctors have to give our patients a reality check. No judgment, no waving the finger, but we do have to say that because of this situation, we have to make some choices, and there's certain things that are no longer optional, they actually become mandatory. So I'm a very active practice taking care of women with breast cancer, and I say that weight management is no longer optional, it's mandatory, and we will work together to get you there. It's one step at a time, but we need to move in that right direction. Alcohol consumption. The more you drink, the higher the risk. This is a proven risk factor. My understanding, it's also associated with an elevated risk of endometriosis. But what we tell patients is stick to 3 or fewer drinks per week. And at the bottom, it actually explains what the alcohol equivalence between various drinks. This is an extremely unpopular message. Usually, the shoes start flying. We actually did a survey online of all the women breastcancer.org, by the way, has 20 million unique users. We're not just number one in the world. We're number one trusted place where doctors send their patients. We're medical experts providing medical expertise 24/7. I started the organization 19 years ago, and we have 200,000 conversations going on in our community where people connect with each other, and we need to moderate those so that they stay therapeutic. But when we asked our people, what would you be willing to do to lower your risk? Of everyone who said, I'm going to do something, only 14% said they were even interested in hearing about alcohol reduction. Because it's self-medication, it's the reward you get, it's any fun social party, there's alcohol, it tastes really good, it's great with food, I'm sure we're going to have it tonight, the speakers, whatever, but I'm just saying, it's good stuff, right? I have 3 kids in the 20s. There's no way I could take them out and not go to a good drinking hall. It just doesn't happen. And also, as soon as you start drinking, not only are the calories of the alcohol, but then you're de-inhibiting, you start eating a lot more food. Alcohol is not a great thing for a lot of reasons. But in any case, alcohol reduction is important, and there are ways to do it practically without being punished. Smoking is a risk factor for breast cancer. And it's not a major one. It's not like it's the same as for lung cancer or other diseases like even colon cancer, but stopping smoking, there's every reason to do that, obviously. Avoiding or taking breaks from prescription hormones. I know it's that the absence of estrogen after menopause causes a ton of symptoms. But we can sometimes piece together effective ways to manage the biggest issues that women are facing. If it's vaginal dryness, for example, really great lubrication, there's a book called She Comes First, which is, the women should be stimulated first so the vaginas are much more receptive to intercourse, as an example. And then if the vagina really needs estrogen, we can do it more locally than systemically. When it comes to birth control pills, 5 years, ovarian cancer risk is reduced, but rather than go on extended birth control pills, let's look at a Paragard IUD or another method of effective contraception that doesn't use estrogen, particularly in women for whom that's an issue because of breast cancer risk or history of breast cancer or breast cancer gene in the family kind of thing. And let's use other methods for treating bad skin than just that. And we should just have that conversation. When it comes to radiation exposure, we know that radiation exposure during organogenesis is associated with a higher risk of breast cancer in the future. We know the story about treating with radiation therapy for Hodgkin's disease in girls. That was associated with a higher risk of breast cancer when they become mature women. So we'd like to avoid the use of medical radiation for girls 8 to 18 up to 25. That includes CT scans with or without contrast. If a girl goes to the ER with pelvic discomfort, she should be examined by an OBGYN or a general surgeon. Ultrasound first if you can before you put her in for a CT scan with or without contrast. Vitamin D. So many of us are now vitamin D deficient, being inside on the computer, working too long, using sunscreen, covering up, etc. And vitamin D seems to be associated with with normal cell regulation. We don't know the whole story yet, but it looks like vitamin D may be protective, so you do want to talk to the women that you take care of about getting adequate vitamin D. Oily fish is not really enough. Food is not enough. You do need to use D3 in order to avoid the requirement of sun exposure to activate vitamin D. Eating mostly vegetarian-based diet and really asking our patients to look at their fruits and vegetables beyond the apple and the broccoli, really to grains, seeds, nuts, spices, and the full range of the rainbow, because each different color provides a micronutrient. And fish, chicken, pork, whatever you like, meat, on the side. Think of it as a side thing. And then when it comes to choosing your produce, you may be aware of what we call the dirty dozen, which is that when they analyze which fruits and vegetables have the highest pesticide levels when grown conventionally, it is the dirty dozen on the that you see there. Basically, apples that you would see in the grocery store year-round, they're only grown during part of the year, but you expect them to be there year-round without any boo-boos because you want to buy a nice-looking apple. Well, that's because it's been treated multiple times and it's been waxed a lot of the time. Berries, don't last long in the grocery store. They're expensive. No store wants to take that risk. They usually get them. They're usually treated in some way. So if you want to stick to the best produce, you would buy the dirty dozen types from organic sources, and then you wouldn't worry so much about the clean 15. Those are the fruits and vegetables that are grown on the right, that are grown without much pesticides, even the conventional way. And all this stuff is at breastcancer.org's Think Pink Live Green section. We also work with the Environmental Working Group that regularly evaluates this through government reports. When it comes to the choice of meats, because of what I said about how beef cattle are raised with hormones, it's not just to increase milk production, it's to get beef cattle bigger, to market faster, that to try to buy it from organic sources, look for the words like never exposed, and never treated with antibiotics, and then to remove the fat, because again, these hormones are lipophilic, and as are a lot of the environmental chemicals, lipophilic will be in the fat, so if you trim the fat off, you're better off, and removing the skin. And then when it comes to fish, try to aim low on the food chain. Enjoy tuna every once in a while, but try to do salmon and smaller fish more regularly at the bottom of the food chain, because at the top of the food chain, the older the fish is, the bigger it is, the much higher concentration of chemicals that are in its flesh. Again, removing the skin and not eating the brown meat at the bottom of the fish. That's a very good way to avoid where the fish itself concentrates these chemicals. And when it comes to dairy products, even organic, try to get the fat-free whenever possible. Enjoy cheese every once in a while, but I'm just saying that generally speaking, non-fat organic sources are the best. When it comes to fruits, foods like this, and particularly edamame or soy products that have the isoflavones that are hormonally active, they're very weak estrogens. It's like 1/1000th the strength of estradiol. I usually tell my patients to have the whole food, the edamame. Soy milk is just a concentrate. You squish out the milk from the edamame. That's soy milk, and then you make a curd of that. That's tofu. That's not really a highly processed thing, but when you start having your patients taking soy proteins, powders, those are pharmaceutical grade concentrations of soy protein, which contains the isoflavones. I recommend that you stay away from that. It's just eat whole foods. That is a better way to go. And then, for weight management, to help people eat well in between, and for children as they get their habits going. When it comes to cooking, metal, cast iron, stainless steel, glass, and ceramic, and not cooking in plastics, even the microwave especially, that's what our kids are doing, and not using those nonstick surfaces. The Teflon is hormonally active. It will get into the food, particularly at high heat, so you never use these pans at high heat. When it comes to plastics, the 3, 6, and 7, that's the recycling code at the bottom. You want to avoid those plastics. Most of our water bottles are number 1, so they don't have the chemicals that we know are an issue. But for the environment, it's much better to use a glass or metal water bottle or another form of reusable water bottle. When it comes to personal care products, we only have to worry about the stuff that people use regularly and that you coat your whole body with. So, for example, we're not going to worry about shampoos, conditioners that come on, that come off. Toothpaste, most people don't eat toothpaste, so we're not going to worry about that as much. There's some issues there. But we are going to be concerned with our patients that are covering their body with moisturizers or sunscreen, because what goes on you does go in you. We know that we're applying medicines to one little patch. You do absorb what goes on you. And so we do tell people to avoid products that contain hormones. There are actually a lot of women who use placental extracts. Those are hormonally active. And to avoid the fragrances, which are an issue, the phthalates that contain phthalates and preservatives. So don't buy big vats of stuff from Costco. Spend more time being careful buying smaller amounts of product. And if your patients want a fragrance, dab on a little perfume here and there. That will give you what you want, but don't cover your body in stuff, because your skin absorbs everything it's exposed to pretty much. Sleeping well. We know that active cells experience about 1,000 DNA hits a day through the wear and tear, stress and strain of living, and we're always trying to repair that stuff. Nighttime is a big time for our bodies to heal itself as we go through life. But aging, of course, is through the wear and tear, stress and strain of living, the accumulation of genetic defects, damage, and also stem cell, regression, all that. But getting a good night's sleep is associated with so many good things: health, reduction in obesity, and there's evidence that it's associated with a lower risk of breast cancer. But it's one of those things that's associated with many different things. Of course, good sleep. Breastfeeding. Breastfeeding lowers the risk of breast cancer. And in fact, it lowers the worst kind of breast cancer, which is triple negative. And the population in this country who's most at risk for getting triple negative breast cancer is actually the least likely to breastfeed, which is young black women born here are the least likely to breastfeed and the most likely to get triple negative. And and they can lower the risk substantially by breastfeeding, even as young mothers. And it is not just connected to black women to breast cancer risk. It is any woman who is young, has a pregnancy, and doesn't breastfeed is at higher risk for triple negative breast cancer. And breastfeeding lowers the risk of breast cancer. Even a month of breastfeeding lowers the risk. And so we really need to encourage our patients to do it. The Affordable Care Act does have provisions that help our women be more likely to start it, stick to it with lactation coaches, pumps provided, time off of work that's protected. We can't let that go with in this administration. And also breastfeeding lowers the risk of endometriosis, which we know is a shared area where people can be protected. It's also important to know your family history of breast cancer. So, Tamara, you mentioned that your father and his father were diagnosed with breast cancer. Breast cancer in men is, of course, more likely to be associated with a breast cancer gene. Genetic testing is required there, but any woman who is 50 or younger diagnosed, breast ovarian cancer in the family, or a combination of other things like other malignancies clustered together, triple negative breast cancer requires breast cancer genetic testing. Anybody of Jewish background, Ashkenazi Jewish background, at any age is a candidate for breast cancer gene testing, with or without a family history. And so that really helps us lower the risk, because if you know that there's a breast cancer gene going on, you can absolutely help her reduce her risk of breast cancer by 90%. And if she's diagnosed with breast cancer, it really helps guide her treatment choices. So if you are at extra risk, you want to take extra steps to reduce that extra risk and be monitored with extra steps as well. And I think you agree, as we come to the end of my presentation, that in order to reduce the risk of breast cancer, the most common cancer to affect women, it will take a movement. And when we think about other movements that were successful, stopping smoking to reduce the risk of lung cancer, they've had huge success. Gardasil to reduce the risk of, and pap smears to reduce the risk of cervical cancer. Wow, was that disease turned around completely. It used to be the most common cancer to affect women. Now it's not. Mothers Against Drunk Driving, we don't even have to go in the cancer space. The Designated Driver campaign, so successful, unbelievable. And when you think about today, what's possible, the most common cancer to affect women, women usually live and to become a champion. There's the next generation listening to all of these messages. Now we have social media, the web. We have so many different ways to engage people. And when you think about how you start a movement, one of our advisors, Lori David, who started, did Inconvenient Truth with Al Gore, and a good friend said, even at the grassroots level, you do one thing, and this is true for all of our patients. They say, where do I start? Start with one thing, do good at it, feel the success, feel that, movement, that momentum. Take up a second thing while you're going, you're rocking it out. Feel good about that, and now you're ready for the third thing. And by this time, everyone on Facebook has noticed what you're doing. Everyone around you in your household sees your change, how it's affected you, and it becomes contagious, and people copy what you do. And that's how you start a movement, and that's what we're committed to. So we ask our people, you've got to believe in yourself.